right, Chris from OrthoWall PT once again. So now when it comes down to like the the last, I guess, of the initial strategies for shoulder pain, you want to do something to try to create a circulatory effect in the shoulder. There's a rotator cuff tendonitis, impingement syndrome, even an arthritic joint. Joints need to be moved. It's the motion in a joint that causes lubrication in the joints. The more that you pump it and move it, the more you can desensitize sensitive structures in the shoulder. And of course, you're trying to push in the good and push out the bad. So there's very much a healing effect when it comes to high reps and low weight exercise. All right, taking your arms and raising them up against gravity, that's a weighted exercise, let alone putting dumbbells in your hands. When it comes to pulleys, it's more of an active assisted exercise. You're actually using one side to help the other side. So if my right shoulder is involved, I'll grab the pulleys, both hands, and I'm using my left arm to help raise the right side. If your shoulder is really sensitive, we'll tend to, or people have very restricted range of motion because of pain, and you can only raise right to here, we'll have them stand and face the door. So the left side's helping the right side, and we tend to instruct our patients as to not pushing into pain. You're doing this as a circulatory effect, as a healing stimulus, not an irritating one. So you're just gonna pump up and down. Same idea, working on good posture. Okay, chin in, shoulders back, and you're pumping up and down. Okay, no pain, up and down, just like that. Could be 20 times, up to 30 times, and doing anywhere from 3 to 4 sets of this, anywhere up to like maybe 100 different repetitions. Okay, when things get better and your motion increases, you can actually stand with your back to, or sit with your back to the door. Same idea, good posture. Now you can actually raise further with the pulley as well. But same idea, you're not trying to push into pain if something's just irritating. You're just trying to get things pumping and moving. If later on you want to start experimenting and seeing if you can actually get up there and use the pulleys to kind of actively stretch a little bit, you certainly can. You just have to be mindful of the fact that if you irritate it, you're going to have to back down a little bit. But when it comes down to pumping, same idea. 3 sets of 20, 3 sets of 30, up to 100 reps. And we'll typically have patients do this probably at least 2 times a day in combination with the trigger point release work that we talked about earlier. Okay? Thanks a lot.